Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs. Okay, so today I'd like to welcome Savannah. Some of y'all may be familiar with Savannah. Savannah is one of the Northside Cancer Institute Oncology dietitians. She works with the high risk and survivors here at Northside. She's a great resource to us, and we're happy to have her. Today she's presenting on Facts on Fiber, Considerations for the Altered GI Function. So thank you, Savannah. I'm going to turn it over to you, and there will be opportunities for questions at the end. So if you think of anything, go ahead and you can put it in the chat, and we will definitely circle back to it. Thank you, everybody.
All right, thanks, Lauren. Good morning, or I guess good afternoon now, everyone. Thanks for being here in the middle of a Tuesday. I'm excited to talk about this particular topic today, which is facts on fiber, but considerations for altered GI function. So some of y'all may have tuned into the fiber presentation here at the CSC, I believe it was last month, where we talked about general fiber tips for most individuals, where the general recommendation is a high fiber diet. But today we're pivoting a little bit and talking about considerations where maybe a high fiber diet isn't appropriate for you or for whoever that maybe you're the caregiver for. So we're going to do a bit of a deep dive. Bear with me while I get to the next slide. There we go. Okay, so a little overview of what we're going to talk about today. So first, we're going to review a couple fiber basics. So if you were in that original Facts on Fiber presentation a month ago, a little bit of it might be reviewed for you. But then we're going to move into talking about specific conditions that might require a low fiber diet. So as we go through this portion of the presentation, there might be certain slides that apply to you, but then there might be other slides that apply a little less to your specific condition. But then as we move through the presentation, we'll talk a little bit more generally about what low fiber foods are, low fiber sample diet menus, if you're a plant-based eater, what eating low fiber would look like. And then lastly, we'll touch on tips for reintroducing fiber once you're moving out of that low fiber stage. So what is fiber? So again, a little bit of review. Dietary fiber is a kind of carbohydrate that's found mainly in fruits, vegetables, whole grains, and legumes. So foods like our nuts, our seeds, and our beans. Dietary fiber includes the part of the plant that our bodies can't digest or absorb, so kind of the roughage or the bulky pieces. Now, fiber is not digested by your body. Instead, it passes relatively intact through your stomach, your small intestine, and finally your colon. So that's where you might hear, fiber helping with bowel movements. We'll talk a little bit more specifically about types of fiber and their impact on what kind of bowel movement condition you are dealing with. So you'll notice that all of these foods that fiber is found in are plant foods. So we're not really getting fiber from animal products like our meats and our dairy products. So in general, for a general healthy population that does not have a GI condition, the Institute of Medicine recommends that we aim for about 25 to 30 grams of fiber per day for women, or about 30 to 38 grams of fiber per day for men. So men do have a higher fiber recommended intake. That has to do with some increased risk of certain conditions, such as diverticulosis, Crohn's disease, and even colon cancer, where that risk is just a little bit higher in men than it is in females. So the American Institute of Cancer Research recommends that we get about 3 servings of whole grains per day, which is about 90 grams a day if you prefer your food in grams. in order to help work towards or as a starting point for reaching your fiber needs. So again, this is for the general healthy population without a GI condition. Usually about 1 serving of whole grains. It's going to be something like a half cup of cooked rice, or 1 slice of bread, or a 6-inch tortilla. And on average, depending on what grain it's made out of, these products usually have 3 to 5 grams of fiber per serving. So on the lower end, if you're getting 3 servings a day, you're probably getting about 9 to 15 grams of fiber just from those 3 servings of whole grains. That really helps give you a boost to reaching that 25 or 30 grams of fiber per day. Then the rest you can kind of fill in with those fruits, veggies, nuts, and seeds. Now, there are conditions like we're talking about, and probably what brings you here today, that do require low fiber diets. So why might we require this? So fiber helps to increase bowel movements. It helps increase feeling of fullness, and overall increases the activity of your GI tract. So if you're facing a condition where we actually want to slow down the activity of your GI tract, or we don't want you feeling quite as full, you might need a lower fiber diet. So the examples of the conditions that we're going to talk through today are diarrhea, gastroparesis, various surgical procedures that might have a low fiber diet prescribed afterwards, as well as a colostomy or ileostomy placement, so right after you've had that placed. So we're going to go through these one by one. And again, if you just joined the call in the past minute or so, not every condition is going to apply to you. Hopefully you'll get a few tidbits, but the second part of this presentation will go through more general low fiber recommendations that might apply to more people. Okay, so first up, what everybody loves to talk about is diarrhea, which we all have probably experienced regardless of whether we have been impacted by cancer. But this is defined as bowel movements that are soft, loose, or watery and are occurring frequently. So probably more than 1 episode per day when you are having a flare-up. There are many causes to diarrhea. Some cancer types can cause diarrhea, as well as treatment for cancer. So maybe radiation therapy on certain parts of your body. If you've had an infection or, a foodborne infection as well. Certain medications, including chemotherapies, have diarrhea as a side effect. Recent antibiotic use might also cause diarrhea by disrupting your gut microbiome and kind of throwing things out of balance. Food intolerances can cause this. For example, lactose intolerance is a common one. If you know you're lactose intolerant and you indulge at Dairy Queen with a big, soft serve ice cream, you might be experiencing this symptom, as well as irritable bowel syndrome. And then recent surgery on the GI tract might cause diarrhea. Some other issues when diarrhea is not well managed can occur. So that's going to be decreased appetite, dehydration because you're losing a lot of fluid in diarrhea. It can lead to weight loss if you're not able to, get any food in, or for it to kind of feel like it's absorbing well. It can also cause weakness and malnutrition in the form of poor nutrient absorption. So if left, kind of to its own devices, this can have a big impact on your health. And if you are going through cancer treatment and this is a big concern of yours, we really want to try to get ahead of it so it causes fewer issues in your treatment. Okay. So how can we manage diarrhea with fiber? So there's 2 kinds of fiber. And we discussed these a little bit back in the first step on fiber, but if you weren't there, we're going to do a little review. So the first kind of fiber is soluble fiber. And this helps to form a gel-like material in your stool and can make the stool more formed. So less of that watery, loose consistency. So with diarrhea, we want to increase this kind of fiber because we want the stool to be more formed so that you're having less frequent episodes and you're losing less hydration and fluids. So some foods that have soluble fiber are going to be oatmeal, rice, potatoes, bananas, applesauce, avocados, strawberries, and oranges. So these are just a few examples, but you might notice some of these foods are on what's often referred to as the brat diet. So if you're feeling nauseous or if you've had the flu before, maybe a parent or someone has told you, hey, try the brat diet. It's actually not an official diet, but some of these principles do kind of work with managing diarrhea. Now, while we're increasing our soluble fiber, we want to decrease our insoluble fiber. This is the kind of fiber that promotes quicker movement of material through our GI tract. So if you're dealing with constipation, which is the opposite of diarrhea, this is the kind of fiber we would want more of. But right now, if you're dealing with diarrhea, we want to slow the movement through the GI tract. So to do that, we want to avoid these foods such as the nuts, the beans, those whole grains that we just mentioned are so helpful in getting your fiber intake in. Things like wheat bran and many vegetables and fruits as well. But don't worry, we are going to talk about which foods specifically fall into a low fiber or high fiber diet later in the presentation. So don't take that as you can't have fruits and vegetables at all. We're just going to modify it. All right, so I do have some other tips throughout this presentation for managing some of these conditions that aren't directly fiber related. So for managing diarrhea, we want to avoid liquids that are high in simple carbohydrates or sugars. So things that have fructose, sucrose, or lactose in them. So maybe milk products, sodas, sugary juices. Those are probably not going to help your symptoms. You also may want to avoid sugar alcohols, which is xylitol, sorbitol is one, mannitol is another. So anything that ends in that OL is probably a sugar alcohol. Then you also want to avoid caffeine and alcoholic beverages. This can also worsen diarrhea. Again, if you are lactose intolerant and you know that, you might want to avoid lactose products completely during this, this time where you're having this symptom. We also want to make sure you're being really careful to restore normal fluid and electrolyte balance. So for every episode of diarrhea, a good rule of thumb is add an additional cup of fluids, which is about 8 ounces. If you can do more, that's even better. And if you need a little bit of extra help, electrolyte beverages such as Pedialyte or Liquid IV is one that's really popular right now. Those can help to make sure we're keeping, all of your electrolytes in good balance. There is a product that is on the market that we recommend to a lot of our cancer patients, or even if you're admitted in the hospital with another condition and you're dealing with diarrhea, we recommend it as well. And it's called Banatrol. Now, this doesn't require a prescription. It's essentially concentrated banana flakes. So that type of fiber we mentioned helps to form a gel-like material. It can help you with that. So this is something you can buy in certain stores or on Amazon. If you're not sure if this is right for you, definitely chat with your doctor or your registered dietitian before purchasing it. And usually you just add it into something like a yogurt or an applesauce a couple times a day, and it can really help with symptom management. Now, it's not a cure-all, so it doesn't cure it completely, but it can help. You also might want to avoid really warm liquids. That can sometimes stimulate the GI tract as well. So if you find that you're having a decaf tea or coffee and it seems to make things worse, you might want to switch to a room temp or a cool liquid. So on this slide, this was just a sample one-day menu for diarrhea. So, feel free to take a picture of this or look at this, go back and look at it in the recording, but it's just a sample. So everybody's going to be different. You might need certain things. You might not be able to eat everything on this menu, but it kind of gives you an idea. So here we've got 3 meals and 3 snacks. You'll notice that there's an emphasis on low fiber grains, so things like rice cereal, graham or saltine crackers, cooked vegetables, soy milk in place of dairy milk, and then decaffeinated tea in place of caffeinated tea. So I'm not going to go through this fully, but yeah, feel free to take a picture. And this comes from the Academy of Nutrition and Dietetics. This is the handout I often give out to some of my patients. Okay, so the next condition we're going to talk about is gastroparesis. This is a condition that affects the motility, also known as the movement, of your stomach. So essentially what's happening with gastroparesis is that your stomach contractions, for some reason, are either slowed down or weakened. So food is moving out of your stomach more slowly. So some symptoms of this are excessive feelings of fullness or bloating. So you can imagine if food is just sitting in your stomach, you're going to feel full for longer. You might also feel a stomach pain or even nauseousness. You might feel some food get regurgitated or come back up a little because it's just sitting in your stomach too long. You're almost certainly to experience decreased appetite. And then constipation and frequent belching also occur. Now, there's a few different causes for gastroparesis. Certain medications, such as pain medications, can cause gastroparesis. Diabetes can also cause gastroparesis, so whether you've had that as a pre-existing condition or maybe it develops during cancer treatment. Diabetes can damage a nerve called the vagus nerve in some cases. This does not happen to everybody or even most people by any means. But this vagus nerve runs from the brain to the large intestine. And if it's damaged, your stomach contractions are going to be slowed, leading to this gastroparesis. Surgery on your esophagus might also cause it. And then for some individuals who are otherwise perfectly healthy, there is no identified or known cause of gastroparesis. So unfortunately, this can affect everybody regardless of whether or not you've had cancer. Now, if you are having decreased appetite, you're not able to eat as much food, you would expect that it's possible that this can lead to weight loss or malnutrition. So when treating gastroparesis, I try to do 2 things. There are 2 big goals. One is to help keep you well nourished, and the other is to reduce discomfort. In order to do that, we might want to limit our higher fiber foods and avoid taking fiber supplements, and instead follow a low fiber diet so that you're not feeling quite as full and food doesn't feel like it's sitting as heavy in your stomach. Because fiber, what we talked about in the beginning, does cause that feeling of fullness. There are some additional non-fiber related tips for gastroparesis. So some examples are making sure you're chewing your foods really well and then staying upright for several hours after you eat, or taking a walk after you eat to kind of help get your GI system moving. Oftentimes, patients will find that solid foods are better tolerated in the morning than the evenings. So they might need to start with a heartier breakfast of solid foods and then transition to more liquid nutrition later in the day. High fat foods can also cause this delayed gastric emptying. So we, in addition to a low fiber diet, also want to work on a low fat diet as well while you're dealing with these symptoms. If you have to take dietary supplements, liquid or chewable form might be better tolerated than the pill form. And then lastly, avoid drinking fluids with your meals because your stomach is going to fill up on both solids and liquids. So we want to sip on our liquids between meals throughout the day so that we're making sure that we're staying hydrated and getting the nutrition that we need. So now we're going to talk about a couple different GI procedures that might require a low fiber diet, either temporarily or for a longer term duration. So the first procedure is a gastrectomy, which is removal of either all or part of your stomach. So in this picture here, you'll see that darker purple is part of the stomach, and that is being removed, and your stomach is kind of being reconnected. Next, we have esophagectomy, which is when part of the esophagus has been removed and your stomach has been moved up and connected to the remaining part of your esophagus. So this is common if you have had esophageal cancer. Depending on where the cancer, the tumor is, this might be a part of your treatment. Now, a Whipple procedure is another GI procedure that typically occurs in pancreatic cancer patients. So in this procedure, part of the pancreas, or the head of the pancreas, the first part of the small intestine, and then the gallbladder and the bile duct are performed on, and parts of those are going to be removed and again reconnected. Then we also have our intestinal surgery or bowel resection. This is performed when part of your bowel is damaged or blocked, and fiber can't be digested by your intestine. So just part of your, your intestines might be removed. Okay, so all of these surgeries that I have just mentioned require a low fiber diet in that first phase following the procedure. For most individuals, after your body starts adapting to its new changes, it has to kind of get used to its new system, you can slowly add fiber back into your diet. So additional tips after surgery are going to be to make sure you're drinking adequate water, eating smaller meals more often, and chewing really slowly and thoroughly so that your body doesn't have to worry about digesting as much food, mechanically. Focus on protein for healing and muscle and weight maintenance. So protein is really important after surgery. Lastly, you're probably going to want to limit highly seasoned or fatty foods. So this, again, can cause a little bit of distress to your GI system as you're recovering. So what are the changes in our body after a procedure that are affected by fiber? So after surgery, it's often, specifically a gastrectomy or part of your stomach being removed, your GI system might not be able to hold as much food as it once was able to. And then in addition, a lot of fiber, like we've been saying, makes us feel full more quickly or for longer periods of time. You might also need to avoid gas-forming foods that can cause you to feel full or bloated. Many of these are also a high-fiber food, such as our cruciferous vegetables. So that's our broccoli, our Brussels sprouts, our onions. Garlic can also cause gas that might make you more uncomfortable, as well as unripened fruits. And carbonated beverages can also cause some discomfort because you've got that bubbling that's sitting in your stomach and maybe making you feel a little fuller than you want to be feeling. Okay. So there is a syndrome that occurs, or you just want to be mindful of if you have had a GI procedure. This is called dumping syndrome. So after your GI system has been perhaps reorganized a little bit and worked on, if food moves too quickly from the stomach to your intestine, it can cause this dumping syndrome. It typically occurs either 30 to 60 minutes after eating, and you might experience dizziness, sweating, fast heart rate, nausea, diarrhea, or bloating. Or it might occur 2 to 3 hours after eating, and the biggest symptoms of that would be weakness, hunger even though you just ate, and increased heart rate again. So again, this doesn't happen to everyone, but it's something to just be mindful of. It typically happens after eating really high sugar and high fat foods. So again, you already might want to be avoiding high fat foods, but this is another reason why. But some of those high sugar foods are going to be added sweeteners like honey, syrup, straight table or brown sugar that's baked into products, fruit juices, sweets, those baked goods, candies, as well as large amounts of unripened fruits. So to prevent dumping syndrome, what we can do is focus on eating our protein food first at our meals and limiting these higher sugar or really high fat foods. Okay, so next we're going to talk about colostomy or ileostomy placement. So this, might be something that has been a part of your cancer or your health journey, and it occurs when part of the colon is not functioning. A colostomy or ileostomy can be placed to help move waste out of the body and kind of bypass parts of your GI tract. Typically, it was about 1.5 months, so 6 weeks after the placement of an ostomy, you are at increased risk of an ileostomy blockage. So choosing a low fiber diet at first is probably indicated. And then again, once that 6 weeks is up, you can hopefully start reintroducing fiber slowly once your GI doctor gives you the green light. So typically after the placement of an ostomy, your diet is going to start with clear liquids and then slowly advance to a low fiber diet. So you might start at clear liquids like clear broth, gelatins, then you might move to a full liquid diet, so things like protein shakes, creamy soups, and then, moving up into soft foods and low fiber foods. It might be helpful to start with smaller, frequent meals and limit fluids at your meal times. And if you are experiencing a lot of excessive fluid loss into your ostomy, we want to make sure you're staying well hydrated. So considering those rehydration beverages like the Pedialyte we mentioned earlier might be helpful for you. And then also foods higher in sodium, so to help replace any, lost electrolytes, lost sodium, and foods lower in oxalates may be advised. So oxalates are a compound in certain foods. They're found in kind of a random array of foods. It's not necessarily one food group, but spinach, for example, is high in oxalates. So if this is something you've been advised against, you might want to check with your doctor or your dietitian to get a more comprehensive list of what foods have those oxalates. All right. So we're going to just go through a couple slides of troubleshooting your ostomy bag. So certain things that might occur, certain problems, and how you can help. So there are some foods that might cause increased output, aka diarrhea, into your ostomy bag, which is, of course, those foods that are high in fiber, like our fresh and our raw fruits and vegetables, as well as our legumes, so our beans, nuts, and seeds. High fat food and high sugar foods might also increase output. So anything fried or really high in saturated fats. Spicy foods, the seasonings, those might increase output. And then same with sugar alcohol. So we mentioned those earlier when we talked about diarrhea with the sorbitol, mannitol, and xylitol. So really with this, we're kind of, matching the diarrhea and the increased output from our ostomy. Those are going to have similar strategies for reducing those symptoms. All right. Now, if your output isn't necessarily high, but your stool is loose, what we want to do is add those foods that have insoluble fibers in them to help thicken our stool and create that kind of gel, get that gel forming material. So again, that's going to be applesauce, bananas, oatmeal, potatoes, white breads, and then also if you're not lactose intolerant, yogurt and cheese can also help with this. Lastly, if you're dealing with excessive gas or odor, there are certain foods you might want to be avoiding. Eggs are one of those foods, followed by onions. Certain nuts like peanuts, beans can cause excessive gas or odor. Again, the peanuts, the onions, the legumes, those are all high fiber foods. Carbonation can increase gas within your stomach. Cruciferous vegetables again. And then also anything that requires you taking in more air. So things like chewing gum or sipping from straws, you just the inside of your body is just getting more air in, and so it can kind of create excessive gas. Foods that might help are buttermilk and yogurt with active cultures if you are not lactose intolerant. And then cranberry juice and parsley are also shown to help to some degree as well. Alright, so we've talked about quite a few conditions, but now let's actually kind of break it down and talk about what constitutes a low fiber diet and what foods can we incorporate. So typically, when your doctor or your dietitian tells you, hey, let's try a low fiber diet, there are two terms you might hear. The first one is low fiber. This is going to typically consist of 8 to 10 grams of fiber per day. So if you think about it, if a general healthy adult is aiming for 25 grams of fiber to 38 grams of fiber, or about a third to a fourth of that intake. Typically, we would want to aim for about 3 grams of fiber per meal if you're just doing 3 meals a day. Or you want to look for 0 to 2 grams of fiber per serving of specific products. So that is if you're looking at bread in the grocery store, you want it to have as few grams of fiber as possible. So you might also be prescribed a fiber restricted diet. So this gives you a little bit more wiggle room and usually has you about 13 to 15 grams of fiber a day. So in this instance, you'd be wanting less than 5 grams of fiber per meal. Don't forget about the importance of that nutrition facts label. So that is really going to be your friend when you're trying to limit your fiber intake. Almost all nutrition facts labels should have dietary fiber included on there. So you can easily see underneath the total carbohydrates how many grams are in that product. And don't forget that that amount of grams refers to the serving size. So just keep that in mind when you're portioning your foods out. Okay, so we're going to break it down into the different food groups and look at what our low fiber choices actually are. So when it comes to our grains, if our whole grains are high in fiber, we want to set those aside right now and look for more of our refined grains in order to make sure we're staying within our fiber budget. So that's going to be things like white rice instead of wild rice, cream of wheat instead of oatmeal, and then cereals made from refined grains such as our cornflakes or our puffed rice cereals. We also want to make sure we're choosing white breads, bagels, crackers, and pastas. So with dairy products, really our dairy products aren't going to have much fiber in them. However, many of the conditions that we talked about also require a lower fat, diet in addition. So in that case, you might want to make sure you're choosing low fat milks, low fat yogurts, and low fat cheeses as well. All right, so what about fruits and vegetables? Because we want to make sure we're getting our micronutrients in, our vitamins and minerals, but we also don't want to cause GI upset. So for fruits, we can choose fruit juices without the pulp because that pulp is going to be a little bit more fibrous. And also make sure your fruit juice doesn't have added sugar in it so that we're making sure we're avoiding dumping syndrome if we just had surgery. We want to choose the ripe bananas. Melons are typically low in fiber. The fiber is mostly found in the rind, which most people aren't eating the rind of melons. But if you are, you might need to take a break. And then also canned soft fruits, so things like canned peaches and canned pears, those will also be lower in fiber. Mostly with fruits, the part of the fruit that we're getting the fiber is the skin or the seeds. So right now, even though we think of berries as being really soft, they have those little seeds in them which can be difficult to digest, which is why you'll see that berries aren't really included in this list. Now, same applies to vegetables. Vegetables that have a skin on them are going to be higher in fiber. So we want to make sure we're choosing veggies without the skin and that we're cooking them well in order for our body to digest them a little bit better. However, we do want to avoid almost all of those cruciferous vegetables. So the broccoli, cauliflower, onions, Brussels sprouts, and there's a few more that fit in that category. We do want to avoid those at this time. Lettuce might be okay, so like an iceberg or a shredded lettuce is usually pretty low in fiber. Strained vegetable juice, so again, without the pulp, will help you get those micronutrients in without getting the fiber. And then skinless potatoes, so think like your mashed potatoes. All right. So for protein, we want to be choosing tender, well-cooked protein options, or meats and fish and poultry. The reason we want it to be tender and well-cooked is because of our poultry or our meats in general have any hard, crunchy bits on them. Even though it's not fiber, it's probably also going to be difficult to digest. We want to avoid whole nuts. Instead, right now, we want to stick to smooth nut butters that don't have any of the chunky bits in them. And we can also stick with many soy foods. So things like tofu, tempeh, soy milk, those are good options, but you probably want to avoid edamame at this time because that is a high fiber vegetable. We've already kind of talked a little bit about beverages. Water is great, and there's not really a condition in which you can't have water. Choose your decaf coffees and teas, and then your rehydration beverages as needed. Okay, so what about for our plant-based eaters who are on the call? So this can get a little bit tricky. So many of our plant-based protein sources tend to be higher in fiber. So when we think plant-based, we think our beans, our nuts, our seeds, that edamame we mentioned is a plant-based protein, certain whole grains. So this can be tricky, but not impossible if you're following a low fiber and a plant-based diet. The first thing you want to do is keep up your protein intake. You want to aim for about half of your plate to be protein foods. So we want to choose low fiber protein options, such as our tofu, our soy milk and yogurt, those creamy nut butters, as well as protein broths. And then also maybe considering protein powders or protein oral nutrition shakes like the Ensure or Gain, Boost, those kinds of things. I have a little star on the protein broths and shakes because remember, you do want to check nutrition labels to compare the amount of protein, the fiber that's in them, as well as if you need to be avoiding added sugars or those sugar alcohols, you also want to check them for those. Not every plant-based eater is fully plant-based. Many plant-based eaters incorporate animal products in small to moderate amounts. So some good options are going to be your eggs, your low-fat and unsweetened dairy products, and then your lean meats and fish. If you're dealing with a condition where your fat is unrestricted, make sure you're choosing healthy fats like your olive oil, your fatty fish, avocado in small amounts might work in order to help make sure you're getting enough calories. And then also, don't skip out on low fiber carbohydrates. This can help make sure you're getting the energy you need since your diet's already fairly restricted, as well as help keep that calorie intake up. Okay, so I've got a sample menu for you here. So again, in this menu, our plant-based eater does eat fish, and then I also believe some dairy products. So at breakfast, we've got the cream of wheat in place of oatmeal with, your milk of choice. So this could be your animal milk, or this could be your plant-based milk, like the soy milk. We also have some canned peaches for a little bit of micronutrients. Then for a snack, on this day, we've got a protein shake. So this is either a homemade protein shake or a pre-bought one. On the next slide, I do have some examples of some low-fiber plant-based protein shakes. At lunch, we've got well-cooked vegetables sauteed in a little olive oil for that healthy fat, with tofu for extra protein, served on top of white rice. So we want to avoid the brown and the wild rice right now. At our next snack, we've got 8 ounces of vegetable juice, as well as some peanut butter crackers on some low-fiber white crackers. And then at dinner, we have our salmon, again, healthy fats and protein, with our canned asparagus tips and our skinless baked potato with a little bit of butter. And then our last snack of the day is a soy yogurt. So I put a rough estimate of calories here because, of course, this is going to depend on portion sizes and how things are prepared, as well as the brands you choose. But about roughly 2,000 calories, which is the reference on most nutrition labels, with about 90 grams of protein and 15 grams of fiber. So if you'll recall, this is actually one of our fiber-restricted plant-based menus, because a low fiber would put you closer to, less than 10 grams of protein for the day. 10 grams of fiber for the day, excuse me. So as promised, I put a couple brands on here of some low fiber plant-based shakes. Now, if you're not a plant-based eater, these are still great nutrition shakes if you are interested in purchasing them. Orgain Plant Protein has about 1 gram of fiber per serving. You'll see right on the bottle, it's got about 20 grams of plant-based protein and only about 150 calories. In the middle, we have Ripple, which is, again, 20 grams of protein and 1 gram of fiber. And then lastly, we have Premier Protein. This is a pretty popular one right now. It does have 3 grams of fiber in it, and it contains milk protein. So if you're, fully vegan or you avoid dairy products, be careful of the milk protein. And know that if you are on that very low fiber diet, 3 grams might be kind of pushing it for 1 serving. So you might want to stick with one of the other 2 options, or browse the shelves yourself to see if there's another one that fits your needs. Okay, so lastly, I'm just going to provide some tips for reintroducing fiber. The most important thing here is that we go slowly. We don't want to overwhelm our system by adding all the fiber back in at once. Instead, I recommend you add 1 high fiber food at a time, and you do that at a very small portion. So just a half portion of whatever it is. We want to make sure you can digest it well and you don't immediately have a side effect. Then after about 1 or 2 days of this, after you've tried this food, maybe try a full portion and see how you do. Wait another day or 2, and then we can add our next high fiber food back in. It can be really helpful during this time to keep a food journal to track what you're eating and then the symptoms associated with. That way you can identify if maybe beans didn't sit well in your stomach or caused a lot of gas. You can make note of that, and then you can come back to that in a few weeks once you've tried and tolerated some other products. So we also recommend aiming to increase your total fiber intake to no more than 5 grams per day every single week. So what that means is if you've been following 8 grams of fiber per day, the first week that you're increasing your fiber, don't go more than 13 grams for that day. And then after that week is up, or maybe you want to give it a couple weeks hanging out around the 13-gram mark, then you can maybe increase it by another 3 to 5 grams of fiber each day. This will help to really make sure you're continuing to give your GI system time to heal and time to adjust to these foods that you probably haven't had in quite some time. All right, so that was a lot of information. So I'd love to take this time. If you have any questions, feel free to pop it in the chat, or you're also welcome to unmute yourself and ask. Okay, I'm just going to give it just a minute if anyone's typing their questions. But also, we do plan on sending these slides out to you all for being here today. And then I believe it's being recorded as well. So you can also have access to that through the cancer support community. And by the way, if y'all haven't been down here to the cancer support community, it's a great space and they have so many resources. So I really recommend, checking it out if you're able to. It's a lot of fun and really a great supportive place with a lot of resources.
Why, thank you, Savannah. And just we'll give a couple minutes for questions if we have any, but I did want to give everyone an update. On Thursday, we do have a cooking demo with Chef Mike. We're going to be doing all things zucchini and squash. So please join us if you are able. And then our nutrition seminars, what you're in right now, we always offer these the third Tuesday of the month. And next month, we will be doing a topic, hydration. So keeping hydrated in the summertime, but also after chemo and just keeping hydrated and feeling good. So that will be offered on the 15th, August 15th from 12 to 1. And I have not seen any questions come through. Savannah, I guess you just answered everything perfectly. So thank you so much for joining us today on our Monday kind of newsletters. That's where we post the YouTube links, or just feel free to check our YouTube page, Cancer Support Community Atlanta, in about a week. Well, thank you, everyone, and have a good afternoon.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.